Welcome back to Consider This with me, Melisa, Idris and Sharaad, Kuttan. The coronavirus outbreak was labelled a pandemic by the World Health Organization earlier today. A pandemic is a disease that is spreading in multiple countries around the world at the same time. So the WHO chief said that he was deeply concerned by the alarming levels of inaction. Joining us now in the studio to help put this all into context is Datuk Dr. Zainal Ariffin, Omar, President of the Malaysian Public Health Physicians Association. Dr. Zainal, thank you for joining us on the show. It's good to have you here. So let's begin there with the WHO's declaration that this is now a pandemic. Why do you think it's being labelled that now?
Actually, this is a technical term in terms of these infectious diseases. First, there are three terms actually. One is this endemic. Endemic is a case that happened in a place for a long time. Number two is
like Ebola, maybe.
Or malaria in some places. And then this is what we call epidemic. Epidemic is a lot of cases in one place, like Ebola and cholera sometimes. And pandemic is, like Melisa mentioned just now, it's a lot of cases in a lot of countries and territories. Say like this now, Covid-19, it's happened in more than 100 countries. So that's why WHO have mentioned it a pandemic. Okay. Actually, it's, in terms of technical term, pandemic has happened a few weeks ago, where it started to happen in many countries. Okay. All over the world.
Now that it is labelled a pandemic, should we be more alarmed? Should we be more concerned than we were yesterday when it was labelled an epidemic or a PHCIE, isn't it? A public health emergency of international concern.
Yeah, actually, in terms of there's two approaches. One is local approaches. And then there's global intervention or global approach, because actually it's not much different for a country when you label it as epidemic or pandemic, because the action is similar. The problem, the difference is because maybe when it's happened in many countries, so there's some sort of restriction in terms of travel. For example, maybe previously you can travel to 10 or 50 countries, but now a lot of countries have this travel ban. But in terms of local action in the country, so usually a country, they have this what you call outbreak management or pandemic or epidemic management plan. They have the phases, for example, they have the containment, mitigation phases. So it's the same. So in terms of like our country, you don't have to some sort of panic or some sort of extra alarming.
Okay.
Yeah. Right. But what about strategies? I mean, you mentioned that the travel restrictions, and many months ago we actually had calls for restrictions when the epidemic seemed to be centered in China, and then there was calls for Chinese tourists to be restricted. Did we make mistakes then? Should we have entirely stopped travel from China, or would that have really solved the problem?
Actually, the important points when WHO declared PHCIE a public health emergency of international concerns, where all countries in the world take extra precaution in terms of to prevent the disease to happen in their country. But in terms of the strategy until now is proven that strict travel restriction is not significant difference between when you have strict or not, because some countries they have very strict, but it still happens because it's very difficult to enforce or to follow the strict travel ban. This is what happened now.
Okay. Well, how would you, I mean, you spent a lot of your career working with the Ministry of Health, right? So you have a bit of an insider view with this, and you spent some time in disease control while you were there. So how would you, I guess, assess the response of the Ministry of Health currently in dealing with this COVID-19 outbreak?
Yeah, Melisa, actually half of my service in Disease Control Division of Ministry of Health. In fact, we have, I faced many outbreaks before, for example, Nipah in Negeri Sembilan, H1N1, SARS, MERS-CoV, and we have encountered many outbreaks. I think a lot of people they experience how to handle these outbreaks. But with the recent outbreak, we have many challenges. We have this what we call a lot of information, and people more aware, and then a lot of communication. So although the paces is same, like for example the containment and then mitigation, but in terms of risk communication is very different because now our citizen, we are one of these the best penetrated internet in the world. So we have people access to social media, people access to information. So this is a problem of risk communication.
All right.
And do you think we're doing enough of it? I mean, I know there's a petition out there calling for more transparency.
Yeah, this is, I'm a retired civil servant, and I'm also I call myself a public health activist now. So we see a different approach. When we have, last time we have SARS, H1N1, ministry a bit transparent, they have, give detail of cases. And then the earlier part of this COVID-19 outbreak, when you have the first wave, the second wave, ministry a bit transparent. They give the detail, they give the contact, the number of cases, and where generally where they came from. But after we're going to the third wave, and after these Sri Petaling events. So we worry because ministry now become a bit
controlled
in terms of information. Now we don't know where the case coming from, what number of this one, how many contact, all this. See, this is a problem in terms of...
I'd like to come back to that and touch on the risk communication. We'll continue this conversation in just a couple of minutes. Stay tuned to consider this.